Hello, welcome back. The topic today is, does age matter for appendicitis? Because most of the people, even aged people, come and say, I have abdomen pain. Doctor, can you rule out appendix? And all they will ask questions. Can appendix can happen? Appendicitis can happen in old people? Yes, of course it can happen, but it's very common in very children between the age of 8 to 18 or up to 20 years is very common. But after that, no age is exempted, but it can happen for the middle age or even if you're 70, 80 years, but it is very rare. And the approach to those people, old people, for the appendicitis is also a little different from others. So the previous videos we have talked about what is appendicitis, what is the treatment, what is the cause, and how to investigate and all. Very simple. Appendicitis, like for anyone, like even old people, comes with abdomen pain, radiates to or it centralizes to the right lower abdomen where we call the McBurney's point. So then pain, fever, vomiting, nausea that can happen. So the doctors, they will ask for after the examination and clinical history, they may ask for X-ray, ultrasound, or even CT scan. CT scan with oral contrast or IV contrast is the best investigations, because especially the old people, the young people, even a simple ultrasound or is more than sufficient. But older the people, it's always better to do a CT scan with oral and IV contrast, because appendix though can happen in the old people because of so many reasons. It can happen just like that, or these people would have had that appendicitis when they're very young, the school age time, they would have had it, but they would have been treated conservatively with antibiotics. Or if they take antibiotic for any other reason, simple cough and cold, or any food poison, they would have taken an antibiotic. That would have been keeping the appendicitis under control. So they were, a very normal lifestyle, those young age. But now the infection has become more, or the immunity, especially if they become diabetic, so the chance of infection is more and the immunity also goes down. So these can happen at the age of 40. So yeah, 40-year-old comes with appendicitis. First is we always rule out any immunocompromised state like blood sugar, I mean diabetes. But 70 age suppose comes, or 60 plus comes with the same history, but we always rule out tumor in the appendix, or even the base of the appendix, or tumor in the large intestine, cecum, or a cecal pathology we call that, or cecum cancer kind of thing. Because in appendix, the outlet of the appendix is blocked, so the secretions cannot be discharged into the intestine. So that is how they get infected and get the appendicitis. Same way, suppose they have a tumor that blocks the appendix mouth, so that it cannot discharge the normal secretions, they get into. So if old people come with appendicitis, always we rule out the tumor part by doing CT abdomen with oral and IV contrast. So if you have appendicitis, or if you feel like having appendicitis, so your doctor will examine you, will ask some questions and do tests, and probably he will be a little more cautious to rule out the tumor part. And of course, if it's a very simple appendicitis, the surgery is done laparoscopically, and will recover very fast, and it's a very simple surgery. And uh, young people, simple appendix is very common. Middle age, probably rule out any medical diseases like diabetes or immunocompromising anemia, these kind of things. And old people always rule out tumor. Thank you.